pilot, a teacher, a dancer, a footballer. In a dream, all these children's futures feel effortless. Just one step and you're in the air, but it's a shallow breath. A breath that arrives late. A heart that asks the body to slow down before life has even begun.
250,000 children are expected to be born every year with congenital heart disease. 75% of these children dying because they don't have the financial resources or the facility to do congenital heart disease.
The Genesis Foundation exists in precisely that gap between diagnosis and destiny. Over 25 years of building a way through.
Trigger point for the Genesis Foundation actually is the loss of our second-born child. We set it up in 2001, but really started the operations by 2010. Our slogan, of course, is Save Little Hearts.
In the early years of their volunteering, they met a girl who didn't even realize what her life could become. Doctors offered skill. A chain of ordinary people did something extraordinary.
We found a case of a girl child who had been abandoned when she was 12 because she had a latent syphilis and it started eating up her face. Literally half of her face was eaten up by this disease. So we managed to get this girl across to the US. And we raised all these funds ourselves with the help of our friends and so on and so forth. And this girl underwent eventually a total of 30 procedures. But they were able to reconstruct her face largely. She got adopted by a family and then she got married, has 2 children of her own. It gave us idea and the hope that you can make a difference if you try hard enough.
And today, for us, all those years later, that very same belief meets world-class medicine. Teams built for the most delicate work there is, repairing a child's heart.
Pediatric cardiac department is probably one of the specialty which is most cutting edge. It demands a lot of hard work, dedication and skill.
Sometimes, international experience even travels back home. Surgeons trained abroad return year after year because the smallest patients leave no room for error.
Trained in India in the undergraduation and post-graduation. I went to US to further train in pediatric cardiac surgery. Then I got a job there and I settled down there. But since 2002, after I became a permanent resident, I wanted to come back to India every year and share my knowledge and expertise with the younger surgeons here.
We don't send children anywhere. We choose hospitals with rigor and we keep the bar high.
We are very careful in the selection of the hospitals we will work with. We've gone up as much as 30-35 partner hospitals around the country, but these days we are down to 25 hospitals because we dropped a few. Because we found that there were deficiencies in some of their operating systems. They would not follow some of our very, very strict requirements for how we do on billing and financial reporting, reporting on the surgery, reporting on the child.
In Kochi, that partnership has meant hundreds and hundreds of children moving from risk to recovery.
Genesis Foundation were amongst our first partners, and you're aware that we've done 500 children together. To change the life of a child, make sure that you deliver care to the ones who really need it with complete transparency at every stage.
And these are the layers that donors rarely see. The steady, meticulous work around the surgery. Documents checked, layered approvals, families guided, hospitals coordinated. In their heart of hearts, donors want only one thing, a certainty that their help reaches the child.
All our cases have multi-level approval systems with lots and lots of documentation checks, as we have to ensure that we are providing the best medical care for pediatric cardiology for the children that we support.
Accountability isn't a slogan for us, it's a habit.
We ensure that all the families are put at ease during this entire process, and all, of course, our donor requirements are met.
We track all our children after treatment too. Because impact is a child returning to life, not just leaving a ward.
So we actually track the well-being of that child for the next 3 years. And a lot of our CSR partners and others, they find that very, very fulfilling.
The work begins much earlier, before the ICU, before the panic, out in screening spaces where families finally get a clear next step.
By conducting screening camps, you're basically giving them a one-stop place where they can come with their children, and those that require treatment are then referred to a higher center.
And when a case is urgent, the clock gets louder.
That's when Genesis Foundation really helps us a lot. They are very supportive in, sending across emergency approvals. It also gives us as a unit even more enthusiasm to, treat such children because we know we have a backing with a foundation like Genesis.
दिल के अंदर बड़ा दुख होता था, महसूस होता था ये सोच करके बच्चे की ऐसी तकलीफ है। बस अल्लाह से यही दुआ कर रहे थे कि जल्द से जल्दी अच्छा हो जाए। बच्चा तंदुरुस्त होता हुआ आ रहा है, भागने में दौड़ने में पहले सांस भर जाता था, अब नहीं भरता है। सही है, अब इलाज होने के बाद में बढ़िया है अल्हम्दुलिल्लाह।
For institutions, trust is built when impact is visible and governance is consistent.
After knowing Genesis Foundation, the credibility and actually the people behind them, right, Mr. Jyoti Sagar and Prema, they have a lot of transparency involved into it, and there is a personal touch to the project. So that is actually the basic reason why we choose Genesis Foundation as our CSR partner for healthcare activities.
Over 25 years, this work has meant thousands of children are back where they belong. And when you change that many childhoods, you don't just change families, you strengthen the country.
It's just a one-time investment in their disease. With some attention to aftercare, you can completely change the life course of a patient. And each of these children have the opportunity to become normal, productive adults.
The lesson is simple. Do the work with focus, again and again until hope becomes routine.
I would say that we would continue doing more of what we are doing. But we would like to start using some of those funds towards advocacy and awareness. Invest in current cases, plus invest for the future.
So if you also believe a child's future can make a difference, be around for our next 25 years.